Although major efforts have been made to implement needed public health measures, we still face many challenges. We are still learning about this new virus, and member states in the region are at different stages of the epidemic. We have therefore to prepare for subsequent waves of transmission, both in countries where case numbers are declining and in those where the pandemic has not yet peaked. We must protect and invest in our healthcare workers. We must continue to engage, mobilize, inform, and support our communities. And we need to make sure that people continue to have access to other essential health services, such as immunization and maternal and child health care. We urge WHO to continue to pursue scientific solutions to COVID-19 and to identify sustainable approaches that will enable countries to minimize transmission while allowing the gradual resumption of economic and social life based on careful risk assessments. We further request that WHO and its partners continue to work with governments and others to help ensure the flow of vital medical supplies and other goods and services between countries. We acknowledge the ongoing work by the WHO and partners in establishing the interagency COVID-19 supply chain system. This is essential so as to allow low and middle income countries to effectively respond to the pandemic according to the international health regulations of 2005. We urge the global community to continue following the principles of international law and the Charter of the United Nations in order to enable an effective response to COVID-19 in every country. We finally emphasize the critical importance of global cooperation to contain the pandemic in furtherance of the right to health and to life, and we therefore reiterate the call by the United Nations Secretary General and the United Nations High Commissioner for Human Rights for an end to those unilateral sanctions which are impeding international collaborative efforts to curb the spread of the virus and treat patients in the targeted countries. Thank you for your attention.
Thank you, Honorable Minister, and please accept our sincere apologies. We will now move on to Algeria, to be followed by Botswana, and then Zimbabwe, please.
Control and contain the COVID-19 pandemic, one of the most unprecedented outbreaks, and perhaps by far one of the most sobering public health emergencies the world has experienced in a long time, particularly for the developing countries. We, however, note with concern some challenges associated with our historic weak health systems, such as inadequate resources and emergency response to public health threats. Other issues relate to financing incident